One of the things I love so about coming to work every day, and hopefully you love, and watching the show as often as you are able, is that when you spend some time with us, we hope you learn something. I certainly do. And one of the people who's taught me a great deal over the years is Charles Miller with Scenic City Neurotherapy. So he thought he would take us back to our first meeting day this morning and kind of remind us of what he does there at Scenic City, because you are obviously watching people's lives improve and change every day with what you do. But at the heart of it is not a treatment, if you will, it's kind of a regrowth of your brain. Is that?
It's a process, but it's what we do is essentially we stimulate your brain to communicate in a more effective way. This means that what we're doing is we're not masking symptoms, we're not treating the underlying feelings, we're optimizing the way the brain communicates to where we don't feel less or we don't feel necessarily even guaranteed better, but we feel correctly. And we get to feel better when we do better.
So a typical candidate, and perhaps you've heard of some of this, would be somebody who maybe is struggling with PTSD, depression, some anxiety, even sometimes some health issues like migraines, some chronic pain.
Many different chronic pain conditions that are nerve-based. But with what we're able to do from a mental health perspective is something we've never been able to address before. The best we've ever seen with antidepressant therapies has been about 40% of patients at 8 weeks will report some improvement in symptoms. The other 60% see no improvement at all. Of that 40% that do see some improvement, about 20% say the side effects of the medications make it almost worse. It's living with the new side effects that come from this medication. What we do, there's no long-term negative effects, there's no side effects to compete with. What we do has greater than 85 to 90% rate of remission.
Okay, wait, I'm going to pause you because maybe other people had the same mistake I did. So when you first began sharing those numbers, I don't think I heard them correctly. You were saying that in certain cases, it's a 40% improvement versus a 60% non, but that's not your
No,
approach.
It's not our therapy. I'm saying that like what people do with a daily antidepressant.
Oh, okay.
Like what we've been doing for decades in treating mental health has had limitations. It's been symptom management at best.
The side effects often will keep people from pursuing a path. So they come to you at Scenic City Neurotherapy, and what you're doing is you call it neuroregeneration, right? So you're rerouting in a way paths in the brain. Is that right?
Yeah, we're waking up areas of the brain that are non-communicative or low communication. And what we're doing by waking these areas up, it's like increasing the processing power of each person. Upgrading the processor in a computer would be a good analogy. It's all the same programs that were running before running after, but they're all just run better.
I had a conversation yesterday or 2 days ago with a woman named Enza who is with Love's Arm Outreach here in town. And they work with women who've been trafficked. And she was talking, she made a comment that often this happens with girls 12 to 15-ish years old, and that the trauma of that, they're kind of frozen on an emotional perspective in adulthood as that 13, 14-year-old girl. So let's take that as an example. And now you have a 42-year-old woman who was once that 13-year-old girl, and maybe she doesn't process things because her brain is still at that 13. Would that be of benefit coming to you?
That's exactly what we do with PTSD. We see this a lot with trauma, is that the patient does not emotionally progress very far beyond the point of the trauma. They still grow up, age, mature, but there's a piece of them that's kind of stuck. And what we do by enhancing processing power, it gives them back. What happens when there's a traumatic experience is that a whole large area of the brain disconnects or shuts off, creating a large dark swath we can see it on a functional MRI scan. What we do is we turn that back on. It doesn't mean that they have to re-experience the trauma or go through it. They're just regaining that piece of their processing component of their brain.
Okay, so let's go with this same example. And now it's this 42-year-old woman who was once the 13-year-old victim, and she comes to you. I know that you like to walk hand in hand, however, with a mental health provider. You don't want people coming to you.
Yeah, we are one piece of a whole process. We are not the whole picture all by itself. Just like, psychotherapy, it can do amazing things. Psychotherapy is the one piece of mental health that's always worked. And in this case, psychotherapy is like the physical therapy to us. It's, you know, after, if we were in knee replacement, psychotherapy would be the physical therapy component. We get the anatomy working the way it's supposed to. The work you do after with your psychotherapist builds it forward. And so it's really the other half of our process.
Which speeds things along, because sometimes therapy can take such a long time to find that progress. It can be frustrating for people. This expedites.
It limits your physiology will limit. Like if it's like trying to run a marathon with a broken leg. If you're working 3 times harder than everybody else and still falling behind, and then you feel bad, why am I not keeping up?
So what happens if somebody's watching you and they think, okay, maybe this might help me, but I don't have a mental health provider? Do you work in tandem with some people to help them find somebody?
We work with hundreds in the region. The thing about therapists is that we have to find one that fits you. Everybody doesn't fit everybody. No matter how talented the therapist is, they may not be a good fit for a specific patient. So we try them on, see how they fit. If it doesn't fit, we'll go get another one.
Okay, something else I almost didn't bring up, but my mind's going there now, and that is the cost of it. You do this often?
We do. We actually do more ketamine infusion than any single facility in the world.
In the world?
In the entire world.
Now wait, Charles Miller, I've known you a long time and I never knew that fact.
I found that out not too long ago. We're looking at the actual numbers people do, and we joke all the time saying it's not that we're so good, it's just there's not a whole lot of people doing this very well, or they do it as a side piece to their initial practice. What we do, we're at a dedicated center. We are open 6 days a week. We do upwards of 100+ infusions per week, along with transcranial magnetic stimulation therapies, and so we have we are a dedicated center to this neuroregenerative process.
So as a result of that, you're able to offer it at almost half the cost of traditional.
Yeah, we're about half of what most people charge for, say, ketamine infusion therapy, transcranial magnetic stimulation. And what we do, every piece of what we do has some insurance reimbursable component.
So each one's going to be a case-by-case basis, obviously. But on a typical client, how often, how long does this treatment last?
Our ketamine infusion process is typically a 3-week stabilization, and then people will do boosters as needed. And that's very individualized as far as how the follow-up goes. Transcranial magnetic stimulation, it is a 6 to 8 week process depending on the patient. And our TMS process is insurance reimbursable, just like any other medical treatment.
And on the ketamine infusions, I think you said that you see about an 85% improvement?
It's an 85% rate of remission, and we use the term remission deliberately. It means that the disease process is no longer holding them back. There's still a lot of rebuilding to do, but it means that all of a sudden, when good things happen, they feel good. If something bad happens, they feel bad. It's all about feeling correctly for what's actually happening right now.
And does the individual client recognize the change? Or do the people around them recognize the change?
They're both. They're the defining change. If they don't perceive feeling better, then they're not better. That's the whole goal. There's no other way to quantify success. We can scan their brain and say, well, everything's communicating better. We can actually see it with a functional MRI. But if they're not feeling it and they're not able to utilize it, it was useless. What's the point? The patient defines their own success.
Okay, and before I let you run, does there come a point at which you're too old for this to benefit you?
No, actually. Our oldest patient we've ever treated is about 96 years old.
What?
Yeah, we did it for neurocognitive benefit, because all we're essentially doing is stimulating the brain to communicate more effectively. We see this being beneficial with that age-related atrophy in the brain or dementia that we see. We see it with traumatic brain injuries. We're able to help them rebuild faster. Stroke recovery. Post-acute coronavirus syndrome is something, it's an inflammatory brain fog. So after the virus, there's an inflammatory response in the body, creating these rapid lesion creation in the brain, and we fix that pretty
There's a phrase in
aggressively.
television, don't bury the lead. Okay, it means don't put the most important part way down deep or nobody's going to hear it. So I guess the 2 parts of you to not bury the lead would be you do it the most of anybody in the world. That's a big statement. And the other is, I know, we didn't mention this today, but I know that the whole reason you did this, you were a nurse anesthetist, but you want so much to educate people on the benefits of it.
This is not, it's like, I tell patients, this is so much bigger than just treating one disorder or this or that. This is the biggest neuroregenerative opportunity we have. It's a process called psychoplastigenic medicine, we are able to, for the first time, address the structures in the brain, not just the neurochemicals. Psychiatry and brain health is progressing rapidly right now, and this is just one of the next steps.
Well, the next step for you, if you want to contact him, is to take down his number. Your first consultation, I believe, is at no cost to you. Is that right? ScenicCityNeurotherapy.com is their website. The phone number 228-0579.